Hi, my name is Pradeep Bhandari. I'm a professor of gastroenterology at Portsmouth University Hospital in UK.
And my name is Dr. Sharmila Subramaniam. I'm a consultant gastroenterologist in Portsmouth as well.
We're now going to discuss our recently published randomized control trial using a novel self-assembling agent called Purastat for hemostasis during ESD. And it's a real pleasure to talk about this. We have previously published our experience related to delayed bleeding and Purastat, and we found that it reduces the risk of delayed bleed following endoscopic resection, especially EMR. We are all aware that when we perform resections using a technique like EMR, then the risk of delayed bleed is high, but intraprocedural bleed is very low. However, when we perform ESD, we find that the intraprocedural bleed is much higher than the delayed bleed. And we wanted to address this situation because in the West, the complications related to ESD is much higher than what we see in the East. And we strongly believe that some of the reasons for these complications is the intraprocedural bleed, which clouds our resection planes, as well as compels us to use diathermy to control the bleed, and that can inadvertently lead to perforations and complications. So this was an ideal opportunity for us to exploit this novel agent to see if we can use a non-thermal means of controlling the intraprocedural bleed and make ESD safer in the West. I'll now ask my colleague Sharmila to explain the outcome of our results and the design of our study.
Thank you. So our study was a randomized controlled trial divided into two arms. We recruited 101 patients in total. They were stratified according to the use of conventional therapy to control bleeding, so that's the use of diathermy. And in the other arm of the study, we randomized patients to the use of Purastat to control bleeding during endoscopic submucosal dissection. We recruited our patients from a population of patients undergoing ESD procedures in the esophagus and the colon, where intraprocedural bleeding rates are, broadly speaking, relatively similar. The outcomes of our study showed, in fact, that there was a significant reduction in the amount of heat used in the arm where Purastat was used. So Purastat was an efficacious agent to control bleeding. In fact, in 92% of intraprocedural bleeds where Purastat was used, it was shown to be effective and no other modalities to control the bleeding were required. Importantly as well, comparing both arms of the trial, there was no increase in delayed bleeding rates in the arm where Purastat was used. We also followed up patients in our study as there have been reports of Purastat being of help in wound healing, and we did want to assess this. So all patients had follow-up endoscopies at 4 weeks post-procedure to assess wound healing, and there was a difference in the arm of patients where Purastat was used. So in conclusion, our study was in fact very promising that a new non-diathermic agent can be used to control bleeding during endoscopic submucosal dissection, and in fact may have promising effects on accelerated wound healing in certain groups of patients in the study.
So that concludes our current study, and important point to note was that use of this agent did not interfere in dissection during ESD. It's a transparent gel which does not interfere, and the planes of dissection were easily visible, and even when the gel failed to work, it was very easy for us to use diathermy as the bleeding point was easily visible through the transparent gel. So in conclusion, the gel seems to be an effective agent to control bleed. It does not interfere with continuation of ESD, and going forward, we would quite like to explore the use of this agent during duodenal and gastric resections where the risk of intraprocedural bleed and delayed bleed is even higher. Thanks for listening.
And I hope you enjoy reading our manuscript in Endoscopy.